yourselves if you have not already. We will have a couple of presentations or one main presentation. It kind of, I'm on the edge now. We're going to see how this all flows, because I've got a first presenter who is a very exciting presenter to us, Carl Ellison. Carl is the president and CEO of the Indiana Minority Health Coalition. And I wanted to bring him on for our last coalition meeting of the year. This is our last meeting of the year, for those who don't know. I wanted to bring him on because with the pandemic, there has come a lot of talk and a lot of energy around partnering with organizations that serve people of color. And I have found throughout this transition that many people, including those on this call, are not familiar with the Indiana Minority Health Coalition, the IMH. We, Health Visions Midwest, is affiliated we are affiliated with the IMH. And if you, please mute yourselves. And so we do a lot of the programming, and they are a grantor for us and provide some programming, the health education programming that we do. So they are one of our main grantors. And so we want to expose you to this resource, it's statewide, so that you know some of the efforts that are going on, not only during the pandemic, but have been going on for some time. And that you may want to take advantage of and be aware of. There are some exciting things going on. I shouldn't say exciting, but things that are very necessary through this pandemic, because we know people of color have been impacted disproportionately. So the question is, how do we reach those people? Well, the Indiana Minority Health Coalition is one organization statewide that is unique and that is focused on reaching people of color and serving people of color during this time. So without further ado, Carl, I want to give the floor to you as you begin to talk more about IMHC, more about what you do, and educate us a little bit about how we as local organizations can take advantage of your services and do what is needed during these times.
All right. Well, thank you very much, Sharon, for inviting me. And it's my delight to always address a local audience to better understand our work, because it's a collective work between IMHC, Health Visions Fort Wayne, and other entities around the state. So I'm going to spend a few minutes to try to give you a little bit of snapshot of sort of what is IMHC, how do we come about, what do we focus on, and I really want to get into some of the current interactions where we try to provide a leadership of a role of voice for people of color on issues like COVID and so on that are impacting the state. But let me just say, before I pull up the slide deck to go through, that it's important for you to know, first and foremost, that there is no other organization like the Indiana Minority Health Coalition in the United States. And that's because IMHC didn't develop following some model. IMHC very, very much is a community-grown, community-envisioned, community-nurtured entity. And way back in the day, when I say way back in the day, and I guess I'll go to my slide deck that'll help make the point. But way back in the day, if you go back 20 years before we came in contact from a funding perspective with Health Vision Fort Wayne, which according to Renetta would be around 2004, 2005. But really, the focus on minority health goes back 20 years to 1985, when the then Secretary of Health and Human Service, Margaret Hecker, called attention to health disparities as a national health problem. Now, I might add that when Margaret Hecker said that in 1985, that really wasn't the first articulation of health disparities. If you go back in literature, you can find health disparities being mentioned when hospitals were being formed in 1909. You'll also find it around the formation of Urban League and our other institutions in the 1920s. So differential health outcome has been something that's been known in our society, but when Margaret Hecker called attention to it, and typically that means that now we want to do something about it. And so how we were going to address health disparities in our state resulted in really Woody Myers at the time, who just ran for governor. Well, Woody was the health commissioner back during the Ryan White days, the AIDS epidemic, etc. But Woody also was the health commissioner who called together a statewide minority health coalition if you will, advisory committee. And that's how I got involved in the mid-1980s on that committee. Meanwhile, at the local level, various communities decided to form local minority health coalitions. So I'm from South Bend, so we formed the St. Joe County Minority Health Coalition in 1987. Somewhere during that time frame, there was an Allen County Minority Health Coalition, and then health coalitions also formed in the major population centers, Gary, Indianapolis, Evansville, and so on. There were, I think, 7 or 9 in the beginning, and our little fledgling organizations with really very little resources. We're meeting in church basements or at the library, whatever. We all got involved as citizens just because we wanted to see if we could do something about this health disparities, these health outcome differences that have been existing in our communities over time, and particularly as we got into the 1990s. And so we worked really not yet as a state organization, but we worked as individual local entities to help the Imhc Council on Black and Minority Health Statute come into place in 1992. This is an important statute, and the brainchild behind it was Representative Bill Crawford. And the presumption was that minority health is everybody's business. So the way you get the state to focus on it is you mandate that there is a council of 21 people, 2 members of the House, 2 members of the Senate, appointed by legislative leaders, and then the governor would appoint people from various organizations, including the IMHC, to give you a committee of 21. But the statute also specifically required that the Imhc Council be 51% minority control. So 51% of the members have to be members of the statutory minority groups. Now think about it. In 1992, Indiana is the only state in the union that has a statute like that, and one that really says, we believe in citizen voice. We want to make sure this is bipartisan. We want to make sure that this is everybody's business. So we create a statutory mechanism to make that happen. I might add this Imhc Council, I think, passed unanimously that year, by the way. But it set the groundwork then for the next year in 1993, when the Minority Health Initiative statute was passed. And that's the statute under which IMHC currently gets about $2.4 million a year. And we use that money to support our central office and to support groups like Health Visions Midwest, who then do Health Visions Fort Wayne, who then do work on minority health in your local communities. And this statute specifically requires the state to fund and develop local minority health coalitions or local minority health voices. So embedded in our statute, again, for minority health, it's important that you know that our state literally says we want citizen voice in minority health, and therefore we will mandate that the State Department of Health has an obligation to use this money to help fund and develop local coalitions. Well, when the first money hit the table in 1994, the State Department of Health actually did try to manage local minority health coalitions of local minority health groups, and we found that dog just didn't hunt very well, because you had somebody from Indianapolis coming to Fort Wayne and telling you what groups needed to meet, what you need to do to try to address minority health. We just found that state control didn't work. So we asked, in 1994, we then decided to create the local coalitions, created minority health, the IMHC. So IMHC is the child of the local coalition. It's not the founder of the organization. It is rather the result of local coalitions decided it needed a centralized voice, a focal point to try to address minority health issues. And then in 1996, 1995, when the first money became available, as I was saying, the state of Indiana took control of those dollars. We didn't find it very acceptable. So in 1996, we asked, I remember talking directly to then Health Commissioner, Dr. Chris Bailey, when our little band went in to see Chris, the health commissioner, and sort of say, would you mind giving us a chance to manage this money? We thought Chris was going to laugh us out, but he absolutely had no problem with that. And so we happened to be blessed with a health commissioner who trusted a little organization with almost no money, no infrastructure, no history, to be, in effect, the sole source contractor for this minority health funding. And at that time, it was only roughly $500,000. It has since grown, as I indicated, to $2.4 million. And so literally for the last 25 years, IMHC has been the sole source contractor for the Minority Health Initiative, and it has been the focal point for operating it. Our story is kind of one of sometimes you get what you wish for, because again, we had really no idea how this would evolve, because there was no model. We just kind of figured it out as we went along. And I must say, And now looking back 25 years, none of us could have imagined that IMHC would be what it has become. Now, the last thing on this slide that's important to know is that if you've been around for a while, you may or may not know that for a long time, most of our health data would be white, non-white. So if you looked at infant mortality, maternal, whatever, wherever topic was, you would get white, non-white. Or sometimes you get white and black, but you would not necessarily get Latinos and others. And so we asked for, and an epidemiology center was funded in 2003 to give us a way to do minority population specific studies, and frankly, to be able to keep the state on their toes to give us better race ethnic data. We made some progress, but we still have a lot of work to do there. Now,
Carl?
Yes.
Carl?
Yes.
You never started sharing your screen.
Oh, I'm sorry. I'm just going along here, just talking away, and
I was wondering. I said, does he want me to start doing that?
No.
Okay.
No, I can do it. I'm sitting there looking at it. Okay, y'all got to forgive. This is just okay. This is just. Can you see me now?
No.
Okay. All right. Let me one more time. Let me go back here. Okay. Share screen. No. All right. I'll give it one last try. Otherwise, Sharon, I'll pass the ball to you. Now try to practice. That did it, right?
Yes.
Okay. All right. So I apologize. I'm going through thinking that you're saying this historical epilogue here, but be it as it may, I think if you didn't share the slides with me, you can afterwards. Everybody has the information. But in any case, the point here was this: that we created a epidemiology center in 2003 to be able to get better at minority health data. Now, from the standpoint of our structure, again, we're a statewide organization that's really governed by our local coalitions. So the majority of our board are these 16 local affiliates. We have 8 at-large members. We're a certified business enterprise, and we partner with many organizations, and we're kind of an independent voice that sits at many tables. And when I say we partner with organizations, in my role, I do a lot of contact with other leaders. So for example, this morning I get a cell call on my cell phone. I get a call from Dr. Jennifer Sullivan, who runs the Family Social Service Administration. And Jen was telling me that this afternoon, the governor's going to announce the first state race ethnic czar, if you will. He's going to have a focal point for race and ethnicity for equity that will be in the cabinet and report directly to the governor. And whoever she is, I know she told us a she, will be announced sometime this afternoon. Now, why did Jen call me that? Part of the reason she called me that is because I, along with others, have been very critical of the state for not having very good data on race ethnic data. Because we found when we were trying to deal with COVID and whatnot, trying to get minority population specific data, let alone get it on a localized basis, has been quite a struggle. And then beyond that, I also criticize the state because if you go like to the state of Minnesota and you look at their COVID dashboard, you'll see that they have it broken down by subpopulation in real time in terms of testing, contact tracing, all the various factors. You go look at Indiana's dashboard, we're kind of in the dark. We don't really have good information to allow organizations and the public to actually see for race ethnic populations where we stand. So anyway, this race ethnic or this equity director, this equity person within the governor's cabinet, and then there's supposed to be similar ones in other agencies of government are supposed to be focal points to give us a better capacity to communicate and to make sure the governor and others know what equity issues exist out there that need some state attention. But that results from partnerships over time, where in my role, if I need to call Jen, I got her cell number, so I just call her. If I need to call Dr. Box, I have her cell number, I just call her. And that doesn't happen by accident. That's a result of deliberate relationship building over time. It's the same thing that you all actually mirror quite well in Fort Wayne, and that we encourage all of our entities to do is to make sure you build relationships with your health department, with your members of the legislature, because what we always say, people help people and people give to people. They don't really give to organization, it's people to people. So we very much practice this partnership being a key aspect of our work and encourage it also at the local level. Now, we have this whole network. This is roughly 20 entities, and our 20 entities that we fund are in areas that encompass about 90% of the state's minority population, and therefore we have, if you will, a localized presence, including in Fort Wayne, where there is need. And then if you were to look at it in terms of a map, you get this type of map where some coalitions will serve more than one county, but if you take together again all of the the whole service area, again, it reflects about 90% of the state's minority population is within those areas. Now, with respect to IMHC in terms of what it does, there's a double entendre here. We actually have a for-profit entity called IMHC Services, but for purposes of this slide, this simply means what services IMHC, the nonprofit itself, provides. And there, we do advocacy, we do the education, like Shirley mentioned of what we fund to do there. We do research, we collect data. We do training, we'll have more emphasis on training on a go-forward basis. And we do some case management activities. And then our local entities do all of the various programs around where there's health needs or health disparities exist. And typically, although our model is high touch, a local funded entity like Health Visions can pick among the issues it wants to focus on, but generally in one way or another, we wind up focusing on all these issues during the course of a year. Now, I just want to spend a minute to talk about some of the current things that are going on that relate to IMHC and our network. As you may know, the Indiana Black Legislative Caucus in February, as COVID was starting to arise, asked the governor to create a task group to prepare a report on the impact of COVID-19 on health disparities in Indiana. Because this is about the time in the nation people finally recognizing that COVID was unmasking significant health disparities in the population of color were suffering most of the deaths that resulted from it. So the caucus then tasked IMHC, and then we work with the State Department's Health Office of Minority Health and the Interagency Council on Minority Health to produce by June 30 this health disparity report. And if you haven't read it, we can make it available to you. But essentially, it just highlighted all the disparities that we know exist, and it pinpointed a lot of the frustrations that still exist. I would say, if you ask me, sort of what were the super themes? The super themes was we still don't have good, adequate race ethnic data with respect to COVID or anything else. You know, in order to be able to target interventions, it's helpful to know not just how many people are not or tested or not tested by COVID in Fort Wayne, but in what areas of Fort Wayne are not tested. You know, we don't have good trend, a lot of good data to then be able to figure out how to do interventions more precisely. So data still remains a major blind spot. Second thing that the report basically shares is the state, in its own wisdom, does not have great capacity to reach and touch and include organizations like ours early on in the planning process. So, for example, when the state was decided how it's going to do contact tracing, we were not in the conversation around how you might do that to make sure you reach population of color. And so it's just, in general, the state tends to maybe ask for a little input. Sometimes it's after they've already decided what they want to do, where it's a react to this. But seldom is a more formalized, can you help us figure out how to plan this? Can you help us figure out a strategy? And so we wind up with being largely in the reactive business. I know you have been there in Fort Wayne around, well, when is that testing site going to be open? And is it in the right place? And people in the community are confused. And then, you know, you have contact tracing where the person may not speak English, but they may not have a contact tracer that gives them information in English. So we've seen sort of all the weaknesses in COVID response related to populations of color, where the state system itself is not very precise. And again, but the primary thing we found in the report was that the state does not have enough capacity to consult with community-based organizations who are on the ground, so to speak, to include our voices in the planning up front, and let alone include us in the actually delivery of contact tracing, whatever the case may be. So we're now engaged with the state, and Sharon has been very involved in this, and others around the state, where the state, I think this was what Sharon probably, 2 weeks ago, maybe, yeah, a couple weeks ago, I get a call from the Department of Health Chief of Staff, and he says, We need your help. We need you to figure out what would be a good messages for that population of color would respond to convince them to take the COVID vaccine that's coming down the road here, part one. And then part two was, and then who would be trusted messengers, ambassadors, who could articulate this? And oh, by the way, can you give me that information by this weekend? I mean, it literally was, because the state is going to prepare, going to do some kind of public awareness campaign. And at least this time, they were asking, well, help us figure out what messages you're going to articulate and help us figure out who the community might trust. Now, of course, I said to Jim, it might be whoever you pick as the contractor to carry out the public awareness campaign. It might be useful if you did a subcontract with Imhc so we could make sure you had minority voices in the formulation of the whole 9 yards. Of course, that didn't get very far, but at least we said it. But it's reflective of the way the state does business. Is now at least they're asking us in advance for input, but they're expecting us to do it all on our dime, on our own time, where we don't really know precisely what are you planning, who's involved, how you're doing it. So we're kind of at the end of the table. We don't have a full seat yet, but at least they're consulting, and it's still not very satisfying because the reality is, and even though I said this to Shane and I've said it to their PR people, and I think Sharon and others have, is that, you've got in communities of color a whole thing about designations, period, in terms of do I really want to go there? And then you have a whole other issue around, do I really trust that this thing is not going to kill me? You've got a whole lot of issues just about vaccine before you get to really then how you do the messaging, and then there's a presumption that these ambassadors are going to want to go advocate for a shot when we know that the vast majority of 60% of African Americans don't trust health systems. They don't trust that you can get a shot. And the same, it's like, I think the next that I've seen is like, that's true for 40% of whites and 45% of Latinos. So you have a very, very, very skeptical public to begin with, in part because of all the mixed information we've been getting. But it's kind of really hard to know who's on first. And then when you have administration that won't cooperate with the next administration, so you can know how this vaccine plan that's being developed will be implemented on a go-forward basis, it's just a real, real awkward time to be asked to provide some kind of coherent input. But nonetheless, we will. So we've been working on some messaging. We'll provide that, and then we'll continue to push to be more involved in the strategy, because this vaccine issue is so important, but it's probably the most complex thing this state and nation will ever try to do. Because as you dig into the vaccine plan, you look at what the thinking is now, it's like, logistically, it's hard to see how you get this to communities of color, even if people want to take the shots, let alone then how you get it to our population in terms of priority groups. Because the state plan assumes that the first group are going to be like the healthcare workers, those closest to the fire get the first dose. And then the second would be groups with who would be at high risk. So that includes the 65 plus, that includes a lot of populations of color. It includes the sickle cell folks. It's all of it's vulnerable groups that we know about. Well, I don't know how you do an overall campaign about take the shot when in the sickle cell community, the issues the education has to be a little different because of the special issues there where, there are side effects to these medications. You got to worry about that. Now, or when you take other special populations, it may be necessary to have specialized messaging and specialized education. And so, like it or not, this vaccine issue for us for the next probably year is going to be a major issue to try to figure out how to articulate this within communities of color, and then how to answer the concerns, and assuming the vaccines prove to be safe. You only know that after it's given XYZ people, you see what happens. But then how do we then provide enough ongoing information to protect our communities? Because no matter how you cut it, COVID will still disproportionately affect communities of color. And if there is a vaccine that can make some difference, we have an obligation to try to help people figure out how to use it. But we're working with a state government that sort of has this notion that you can sort of create one set of messaging, one set of ambassadors, and that somehow will solve the problem. It's kind of like, it's really sort of, if you think about it, step back, what the state is saying, we think race ethnic populations are one group. So give us a message and invest that will affect that one group. When the reality is there's so many subgroups among the race ethnic population on this particular issue that you would need to isolate and educate, that this requires a much more comprehensive, a much more detailed effort than the state is articulately recognizing at this point. So be it as it may, we've created our own COVID designation task group, and we'll continue to follow the research, and we'll probably see if we can position ourselves to, if the COVID resources out there, to maybe be part of this effort over time, or else we'll be a voice to the state saying, this is still resonating, because one of the issues that's going to come in our call Friday is what level, what portion of subgroups that take the vaccine, what should be the appropriate target? In other words, do we some success that you get 10% of them, or success that you get 50% of them? Well, once the state answers that question, that will also then give some rise to additional work we may do. Now, I've just taken the vaccine allocation over the last 3 weeks as one measure, but remember, we still are addressing. We don't still have enough tracing. There's not enough PPE. There's the contact tracing process in the state is still not superb. So we still have those issues to follow. And then we also are looking at some of the issues I identify here that we're working on related to public health, maternal mortality, et cetera. I can tell you that one of the big issues we're going to be working on again this year would be an increase in the cigarette tax. It appears that there is some growing bipartisan support for that. And so if cigarette tax happens and there is some additional resources there, then what we're trying to do is to make sure all those resources are devoted to health, and that a specific set aside within is set aside for minority health. Because again, if our community is disproportionately affected by something, then we think there needs to be disproportionate funding to address it. So we'll see how that rolls out. And then, again, if you look at maternal mortality, infant mortality, these are all areas of high need that we will continue to focus on, but this is not exclusive. I would say when we are doing our advocacy day and as the session goes on and we pass on to Sharon and others our advocacy agenda, I would encourage all of you to be very, very active this year. Whether it's talking to your legislature, sending a message to your legislature, it's very important that the legislature know who Health Vision Fort Wayne is, and it's important they know that Health Vision Fort Wayne is tied to Imhc. It's very important that they know that we expect them to concentrate on our areas of disparities, because until you can address the disparities, then it cannot improve the overall health of the state and its capacity to be even more productive, to be and even greater its outcome. The last thing I'll just point to before I pause is that part of what we continue to say in terms of need is that if you look at the Minority Health Initiative, we've been funded flat for the last 12 years. But the need for our services for more focus on minority population continues to grow, as evidenced by the growth in Indiana as a state is primarily driven by minority populations, not whites. So like the rest of the nation, Indiana will become increasingly minority in its composition over the next 20 years. And if you look back just in the past 20 years since 2000, you see there's been a 29% increase in African Americans, 68% increase in American Indian Alaskan Natives, 100% in the Asian Pacific Islanders, 125% increase in Hispanic Latinos, and 183% increase in Asians. Now, I might add that when we've had these large increases in population, they're not occurring evenly all over the state. So you might want to go back to 2000, look at your own county or your own service area and say, okay, what were these populations in 2000 versus now? Or if you don't have the data, just contact Anita Ullman in our research area and we can supply it to you. But I just find that the way to start talking about our need for more resources, just to say, we are more of the community and therefore we need greater attention. It's expected in our state that it was expected the Latino population would grow in that regard. It was not expected that Asians would. But throughout the Midwest, the growth in Asian populations is pretty substantial. And so that trend may well continue over time. So I realize I've given you a lot of information, but the point of Imhc is We just improvise every day. There's no playbook exactly in terms of what we are to do. We try to be practical. We try to be in your face. We try to play nice, but we also try to speak truth to power when it comes to populations of color on a routine and regular basis. And as I put it, sometimes we can be your best friend or your worst nightmare. I mean, our job is just to not allow you not to know that a disparity exists and not to challenge any organization to help us address it. Because in the end, minority health has to be everybody's business. And IMHC, Health Vision Fort Wayne, we cannot in and of ourselves change the adverse health outcomes that exist in our communities. We do need all sectors to help us. And so just know that IMHC for 25 years, we've been a town crier, and we appreciate the fact that you all have been part of town crier with us. And again, if you take away nothing I said today, is stay involved, build relationships, and be a good town crier. Now, let me just conclude by saying that when you think about relationships, just so you know, I go back to Don Barnes. Don Barnes, the initial Health Vision Midwest CEO, was a very good friend because Don Barnes, believe it or not, back in the day, actually was the boss of David Ruth, who became the CEO of Covering Kids and Families of Indiana, and Mike Kalinda, who runs the Windrose Federally Qualified Health Center south of Indianapolis. And so Don was a fixture in terms of collaborative work across many fronts for many, many years. And Paula, I'm glad you're on the call today. So Paula inherits a tradition of collaboration that we really appreciated at IMHC. And so I just say that to add that minority health really has been all these threads of connection over time that may not be apparent. But in many respects, I'm hoping that we can continue to expand the relationships and the connections between our organization and yours and others over time, because really we are the safety net for Black and minority health. We are it. And so the stronger we are, the better we have the opportunity for some progress. So let me stop and ask if there are questions.
Thank you so much, Carl, for that informative presentation. We certainly appreciate it. And I think that I speak for everyone on the call that we have learned something today. I asked a little while ago that if you have questions to put them in the chat. And I see that we do have a few questions that we want to pose to you, Carl. The first being, what are, and I'm not sure if you know this, but what are the racial demographics of the Indiana State Department of Health? Carl, you're on mute.
Let me unmute. Yeah, okay. Thank you. I actually had a chuckle when you first asked that question. I don't know offhand. I do know that if you look at the Department of Health leadership, like go to the IDSH, now, by the way, the Indiana State Department of Health is now the Indiana Department of Health. But go to the Indiana Department of Health website, and under the About Us, they have, there's a tab you click on which would show their organizational chart. And so if you were to go find that, and you say, okay, who are the leaders of color on that chart? Once you, in the top tier, there are none. When you get to the next tier, you will find Shirley Payne. And Shirley is the, how can I put it? Well, Shirley has been children with special healthcare needs, but she has been recently promoted to assistant commissioner. And then once you get beyond Shirley, I think next you probably get down to Internet Hope at the director level. And there may be one or two others, but out of all the top executives at the Department of Health, there's very few people of color.
Okay. Okay, thank you for that. Very few people of color. So what can organizations do to support IMHC and the work that you are doing to advocate with the State Department?
Well, I would say just participate in any of our various advocacy offerings. You know, we do a lot of things that are topical in nature, whether it's on doulas, breastfeeding. We do various topics. We also do a lot of town halls, and during session, you might we may do some town halls there. We have historically, but with COVID, I'm not quite sure how it's all going to work out. But I would say, yeah. So follow us on our Imhc website. We've got a little YouTube channel, but you can keep up with a lot of our information on Facebook, Twitter. Just follow us, and that'll give you an idea of activities in which you can also participate.
Okay.
The other thing I would say, and if you have some significant activities going on in your own community, make sure to invite us. You know, we want to be more present in your local community to support whatever you're doing as well.
And Carl, can you perhaps put some contact information in the chat in terms of if people want to invite you, how do they get in contact with IMHC?
Sure. Okay.
Okay.
That's all right. Sure.
And a couple of people have, while he's doing that, a couple of people have asked, can you get a copy of the PowerPoint? We can certainly get a copy of the recording of the meeting. Carl, can I just make your naked PowerPoint available, or?
Absolutely. Yeah.
Absolutely.
Fact,
there you go.
Because that has my name and my number on it. I think.
Okay. Okay, so there you go. We will be able to get that access. From Dr. Kane, what is the Indiana Department of Health's response to obtaining accurate racial demographics for COVID-19 tests, positive cases, deaths, and contact tracing?
Dr. Kane, you said a mouthful there. Well, I don't really know. I'd have to go back and ask Dr. Lindsay, or one of the leaders, but as you know, in the beginning, the state did not collect that data. People were not collecting it. So that's why when you go to the website, you'll see that 20% in terms of the demographic are other or unknown. And so the state's baseline has never been a good one to begin with. I guess best I can tell you is that the protocol now is that the state is supposed to ask, if you will, but I don't think that data is still systematically collected. But why don't you? Well, tell you what, I'll ask and I'll respond back to you after I have a chance to ask them. But it's just something I don't know about personally right away.
Okay, another good question. Can organizations become members of IMHC?
Well, we're a membership organization, and sure, anybody can join. There's a different membership fee if you just want to be a member of the organization. If you mean, can any organization apply for funding from IMHC, the answer is technically yes, although we will continue to fund Health Vision Fort Wayne, so we're not likely to fund a second entity. But we are a membership organization, and we're like, the NWC, Urban League, whatever. We're happy to take membership money. When our website is under construction, but when it's back up and running, there'll be a tab called membership that will allow individuals, organizations to contribute. It's something we're going to emphasize more over time, because when you go into the legislature, it'd be helpful to say IMHC is a member organization with 500 members, or IMHC is a membership organization with members from 92 counties in the state. It's something that we've not emphasized, but we're adding a donor view software, and we're adding some staff to be able to really promote membership over time. And again, it's not so much for the money; it's more for the ability to say that we have identified a broad range of supporters who have become members of the organization.
And Carl, now during your presentation, you mentioned this just a little bit, and I want to make sure that it didn't get lost, because I'm going to probably be asking some things of our organizations in the coming weeks. And that is about the effort to create messaging and ambassadors in local communities surrounding the vaccine. So we've got, everybody's seen on the news about these vaccines that are coming out for COVID-19. Our fear is, or I shouldn't even say fear, we know that people of color are less likely, polls have said they're less likely to be responsive to that vaccine. Mm-hmm. And so the state is working on some messaging, but Carl and IMHC have decided to create a grassroots network surrounding that. And one of our first efforts is to create a survey. We're finalizing that. And that survey has a number of questions that asks people how they what would make them more responsive to the vaccine? What would make them take the vaccine? I don't know if any of you guys have heard, but I've been hearing all kinds of theories, end times, Armageddon. If you take the vaccine, you're going to be marked. Just all kinds of things in communities of color about the vaccine. And I have to be honest, I'm a little like, what is in this vaccine? So what we want to do is we are trying to nail down messaging that will reach our communities, because these are the communities that are disproportionately affected by the virus and that may be in most need of the vaccine. And so in the coming weeks, we're going to be circulating surveys. We're going to be asking organizations in Fort Wayne to circulate these surveys to figure out how we can best reach people, how we can get information out that is necessary so that people will feel comfortable with taking this vaccine. Carl, do you want to talk a little bit more about why you felt the need to create the grassroots network within IMHC in addition to what the state is doing?
Yeah, well, part of this is that, again, we are the last line of defense for our communities, the way we look at it. And so our group, by the way, Paul, to your question, is we're both African-American and Latinos. So whatever we send out in terms of surveys or as we identify who might be ambassadors, we're doing it on a race ethnic specific basis because we cannot rely on whatever PR campaign the state does to really reach or educate our communities. So the purpose of our network is to be able to try to provide some feedback as to messaging that may or may not work. But beyond that, we want to try to identify, if you will, in each community, groups to whom we can share information, to whom we can educate. So for example, in Indianapolis, there is a group of Black hairdressers. So that would be a subgroup whose information we would collect, and we would ask them to be part of our network for purposes of being able to distribute information. So we want to go through and try to systematically identify those key groups, and by inference, some key leaders in the area, primarily for continuing information provision. And because again, we assume that the state would not necessarily, for example, in this campaign, automatically do everything in English and Spanish. So with respect to our survey, but we're sending out in English, we also send out in Spanish because we have that capability. Because again, we fundamentally think the state's posture is there's somehow a one-size-fits-all campaign is going to work. We fundamentally don't believe that, and don't believe that the state it typically, and I think the example that I've used from South Bend is a PR firm will say, where do I get the most eyeballs on this message? And so in South Bend or in Fort Wayne, they'd go to WANE, which would be one of your big TV stations, right? They look at, because they get a lot of viewers. They would not go, in South Bend's case, to Reb Williams, WUES, or there may be a Reb Williams equivalent in Fort Wayne that, that's been doing the Black spirituals for 25 years and has a listening audience that's wired into our communities, or would not necessarily go to the station that provides similar programming for Latino communities. So we want to make sure we identify not just groups to whom we can share information via Facebook, Twitter, and so on and so forth, but also that we can identify and feedback to whoever the state selects to do their PR campaign, that they really should be using these media vehicles that reach populations of color, so that we have a shot at getting the message there. Now, like everything else, we've never done any of this before, so I can't tell you exactly how it's going to evolve, but I think I am at the point where I recognize we need to treat this like a campaign. We probably need to set aside enough resources to staff it. I think it is full-time work. And I do think that having a more connected network across the state for communities of color is a good thing, regardless of the COVID-19 vaccine issue that arises.
Okay, thank you, Carl. Will the surveys be in English exclusively or available also in Burmese and Spanish, etc.?
Correct. They have been translated both into Burmese and Spanish. So we've got we've got Margarita Hart and involved in this, and then we've also got everybody on the Latino side, from Lillian Quintero, who's our Northern Hispanic Health Coalition, Brenda Diaz, and we're also reaching out to the Native American community. So as we build our network, we're trying to make sure we touch base with leaders of all subgroups. And again, our presumption is that we may have to customize the question or the messaging in such a way that it best reaches those groups. But we also want to be able to, if you will, build a platform where we can communicate on a continuing basis beyond just asking questions about messaging.
And so, Carl, we're looking to have those surveys out and ready for distribution by next week, right?
Actually, the state wants them out today. They already know what their response is. So I think we have a call with internet around 11 or a call around 2, but sometime between today and tomorrow, yes, we need to get them out.
Okay.
Because, I mean, and by the way, you might just talk about the type of questions we're asking, and it's not a very long survey, but just why don't you talk a little bit about what types of information we're seeking?
So the types of information are you know, some of your basic demographic information, but then also in the last iteration I saw, it's been changing a little bit every day with different input. That's good input. But the last iteration I saw, it asked, you know, point blank, so would you take the vaccine? And people answer yes, no, not sure. And then there's a question that says something to the effects of, what if no, then what would, you know, change your mind? What kinds of information might change your mind about taking that vaccine? Or if not sure, what would make you sure? And so then there are different options, you know, more information, guarantees, more information about side effects, information about the cost, those types of things. And then there are some questions about, you know, who do you trust to, you know, talk about this vaccine? Would it be, what organizations do you trust? You know, Department of Health, your doctor's office, and then who do you trust in general in discussions? And I'm not sure where that question is, but you know, we were trying to find out who are the ambassadors at your community level that we could talk to, or that the state could connect with, and provide those people with accurate information about the vaccine and its effectiveness, and you know, who's going to pay for it, so that people have all the information that is available at this time to make an informed decision. So some of those are some of the questions. I think it's like 6 or 7 questions, yeah, at the last iteration that I saw. And so we don't want to get too in detail, but we do want to find out how we can reach people and get the best information to them. So that will be coming out in the next day or so, and I'll be sending the link out to you all. Will it be online? Yes, it's an online survey. And so then we will be sending out the link. And just like we did earlier this year when we did a survey with Parkview Miro, to find out people's you know, needs during COVID or at the beginning of COVID, we will make this survey in such a way that community health workers or friends or partners or whomever can fill this out for people who don't have the technology to fill it out for themselves. So if they don't have their own computers, or you know, whatever the case may be, they're not able to fill out the survey, then someone else will be able to fill out the survey on their computer. So that's how we're kind of setting it up right now. Like Carl said, this is a fast moving train, but it is so necessary because we really need to get the accurate information out to people, because I've heard so many theories about this vaccine, and people are just afraid to take it. So we want to be mindful of that. Are there any more questions?
By the way, I just want to say, Sharon, we have a 3 o'clock call, so I'm fairly certain that once we finish the 3 o'clock call, it'll be go for it with the survey.
Okay. Okay. What is the time frame for gathering the information?
Again, the state is in the process of contracting with a PR firm, and they want this information yesterday. But from our point of view, you know, we'll give them some preliminary information early next week, and then we'll just take the time to further refine it over time. You know, we're not going to be driven by their schedule, because I think that again, they're looking for, and we'll have some discussions with them, I suspect, but I think they're looking for one key, And what we're inherently saying is, no, you've got to have a campaign that's customized down to specific populations and specific localities. If you want to do it right, you got to, it's more than, you can't do this one size fits all and expect that's going to really resonate. So we'll see if the state has the will to really go about it the correct way. Now, if it turns out, let's say, that the state's campaign doesn't really respond to our needs, then there's nothing that precludes our grassroots network from creating our own messaging, from doing our own campaign. This is life and death for our communities. And again, the state's methodology is, we'll tell you how we're going to go about it, and we'll ask for a little input, but we won't really involve you in the strategy. And so I think, we'll do what we can to help them, and we'll see what they do, and we'll tell them what they need to do. But if they don't want to do it, then, we can go direct to the legislature. We have a lot of weapons we can use, but for the most part, we want to make sure we build a strong grassroots network that's statewide, and we'll make sure we identify as best we can who are the folk we need to get information to be voices of the community, help us at least educate our community. Whether people take the vaccine or not, they still need to know what the risks are, and like everything else, the vaccine, in terms of its effectiveness, may evolve over time. And so, because I don't want to take it today doesn't mean I might not want to take it 6 months from now. But what we want to do is have a network so we can provide meaningful education, meaningful information all along the way, in the hopes that if this vaccine really does work, that we are able to make sure our community gets our disproportionate share of it, because we have disproportionate need in terms of adverse outcomes from COVID.
Paula wants to know if she can share this information with Illinois COVID.
Absolutely. Now, the group didn't tell me to say that to you, Paula, by the way. That's part of the slowness here, is we're trying not to I'm trying not to get ahead of the group, because it really is just a group of folks together. But I'm thinking, yes, to the extent that the questions help anybody identify what are some of the barriers, I think what you find in Illinois will not be terribly different from what you find in Indiana. And I'm pretty well convinced that what the first round is going to tell us is that people disproportionately are confused. They don't trust, but they also got so many mixed messages, they're frozen. They don't know what to do. And so if your core problem is, I've heard so much stuff, I don't know what's the truth and what's a lie, you may have to spend some time just trying to, if you will, reset the information chain before you get more into COVID vaccine education. But anyway, we'll see. But yes, do share widely, and the most community impression information we can get, the better.
We have just a couple more minutes left, and Kidani wants to has a comment that the campaign in regards to the vaccine needs to focus not only on buy-in, but also on access to communities that are affected disproportionately.
Absolutely, and to the presumption is that Operation Warp Speed may or may not remain the same once you get a change in administration here, because there are some if you read the state's vaccine plan, I think you can. I mean, I have it. I don't know if we can share it if you haven't seen it, but if you read the state's vaccine plan, it makes assumptions based on current thinking of CDC and the current administration. What we don't know is whether that will be the same once you get to January 20th. I suspect there'll probably be some modifications, because in terms specifically of how you deploy it, that's where I think that's the biggest challenge. And I suspect that the Biden people may have some different ways of looking at it. So yes, we will focus on how it gets distributed and how we can make sure our communities have best access to it if they want it.
All right, thank you so much, Carl, for this information. And I just want to emphasize this. This is why I wanted everyone to meet Carl, who hadn't met Carl, meet him virtually, because this is the type of thing that IMHC does and does well. So we've got this situation where we're in a pandemic and people of color are being disproportionately affected. Someone at the state level needs to step in and say, these are the needs, and we want people who are in those communities to be involved up front. Who does that? what agency is available to do that, what agency has the resources and the power to do that, and that agency is IMHC. So I wanted you all to understand a little bit more. I don't know if we could get the full breadth and depth of IMHC in this call, but I wanted you to kind of understand what IMHC is all about and what a valuable resource they are for us statewide. Especially, now this is a perfect example with this messaging effort. In the coming days, you will get 2 surveys. One is our regular survey that we send out after we have coalition meetings, and you'll get that survey link and some information about that. You will also get the survey that we've been talking about today, that we want you to disseminate to your clients and to people that you serve, so that we can better assess how we can address this messaging issue with regard to the vaccine. If you look on your agenda, you will see that I was supposed to present today, but I had a feeling that we would not be able to do that, because I wanted to not only expose you to what IMHC does, but I knew that I also wanted to talk more about this messaging issue that is fast moving and that we need to get on as a coalition. So I'm going to save my presentation for January. Again, this is the last meeting of the year, so we will not meet next month, although you will be receiving some information by newsletter and emails and things like that. Does anyone else have anything else to say? You can take yourself off mute and say it if you have anything else to say. Any news that you want to share from your network? We usually end at 11:15. Any news that you want to share from your network, from your organization? Any comments? If so, just go on ahead and unmute yourself and go on ahead and say it. Joellen?
Hi, Sharon.
Okay.
Hi, Sharon. This is Renetta. How are you?
Good.
I am the president of Zeta Phi Beta Sorority Incorporated, and would like to invite everyone to come to a mental health Zoom that will be December the 5th at 3 p.m. and I will send a flyer that you can distribute. We know that COVID has impacted all of us, and mental health is a major issue for all of us. And we just want to be able to reach out to not only the minority community, but anyone that need help. So we're excited about doing it, and we wish that you would share that. And once again, Carl, congratulations, great information. Health Vision has been a part of this partnership since we started in 2003, and we actually got the contract in 2005, so 15 years of serving the community. And Sharon doing a great job of continuing the legacy that we started here in Fort Wayne. So congratulations to both of you.
Amen. Thank you very much, Renetta.
You're welcome.
Anybody else?
Yep, this is Raquel. How's everyone doing? Nice to see everyone.
Hey, Raquel.
Hi. So much has been said prior to this COVID, much had been said about how we were going to transform our healthcare system because of all our health disparities. However, today, more than ever, like you said, Carl, we really need to provide this education around the immunizations, about COVID, how to move forward to our community. So with that being said, and you did mention it, that we needed advocates, we needed trusted members of our community and community health workers, because they are trusted members of the community, would be well poised to get in our communities and do this work. So with that being said, we have Health Visions has a 45-hour intro approved training. It's self modules, and it's also online training. It is $1,200, and it runs for about 5 weeks. It runs for about 5 weeks, and it culminates in a certification in Indiana. So if anyone would like more information, please visit our website at www.hvUSA.org. Thank you.
Raquel, when's the next session start?
So we are finalizing our 2021 dates, and they should be up soon.
Okay. All right. Okay. What?
I had a quick announcement of an upcoming event. Hi everyone. Rachel Joseph from the Shepherd's Hand Community Outreach Center. This coming Sunday from 4 to 6, we are having it's curbside service only, but takeaway meals with Thanksgiving food variety. Over 25 different people from our community have are coming together to, I mean, not coming together, but have separately cooked different things for our meals. So a lot of community participation in this. And so if you know anyone who would appreciate just some takeaway hot meals, Thanksgiving food, this Sunday, we're located at 1231 South Anthony, close to Indiana Tech. Again, it's going to be curbside service only. So we're going to have signs and people directing traffic, but we'll ask that everyone stay in their vehicle and we'll bring the meals out to folks.
Awesome. I'm going to read a couple of things here in the chat. Joellen with Covering Kids and Families of Bright Point, they're hiring some bilingual coordinators, and they are still accepting phone appointments for clients with limited in-person appointments. Bright Point did close its doors again to walk-ins due to COVID rising, but someone will be there to meet clients. She's got a lot of information in the chat there. If you can read that and take down the number and contact information, that would be great. Kidani says that they have received free face coverings from the United States Department of Health and Human Services. And Kidani Sarko is with Purdue University Extension. So that's who he is representing. The face masks are 100% cotton jersey. And let him know if you or your organization have a need for face masks. Okay, thank you, Dr. Kane. Yes, I'll be giving a presentation in January to start things off. And at that time, we'll talk a little bit about the Allen County Health Disparity Coalition and some changes that we can make. I want to get some feedback from you all. I might send out a survey. I don't want to bombard you with surveys, but I might be sending out, I likely will send out a survey in the coming weeks to find out what you would like to see the coalition doing in 2021. Sarah from Amani Family Services says we will be at St. Patrick's Church on Harrison Street on November 30th. And they're going to be, and December 2nd, passing out PPE. So check the chat for more information on that. And Katie Murray with Neighborhood Health is also hiring for a RN and much more. So there is some information. Again, look in the chat for more written information on that. Am I missing anything? Miss Peggy, am I missing something?
I'm going to be doing a Facebook Live presentation with Dr. Ray Gaffney, who's the president of the Congress of Christian Education. I'm going to be talking about diabetes, as it is National Diabetes Month. So I know Carlos has sent out information about this, and it's my first Facebook Live. So y'all pray for me and help me out. So it's going to be at 6:30 on Monday.
She is going to do great. And you all have gotten the newsletter. I sent out our newsletter yesterday. And so you can check that out. And there's a link to how you can join on the Facebook Live in the newsletter by going to their Facebook page. All right, anything else?
Yeah, check out those recipes and on the newsletter too.
Oh, yeah, okay. Thank you, Carla. They are healthy recipes, diabetes friendly, but even if you don't have diabetes, it might prevent you from getting diabetes. Anything else? So we've got the information, the links there to some of the things that were said in the chat. Thanks so much again, all of you, for hanging with us throughout the pandemic as we transitioned and adjusted to a virtual setting. Again, hopefully things will continue to adjust for the better in 2021. We may continue to do virtual in 2021, and then also some other options as well for the coalition. So I look forward to finding out what your needs are, what your desires are, what your vision may be in terms of how your organization can partner with us and work with the coalition. And in that way, also be working with IMHC and working for the betterment of our health for people of color, and the health that we want to improve throughout this pandemic and beyond. Any more questions, comments? Thank you so much. We will see you the 4th Wednesday in January. We'll be going back to Wednesdays. We had to change up a couple things in the past couple of months, but we will see you again in January. Thank you.
Happy holidays.
Happy holidays, everybody.
Bye, everybody.
Bye.
Bye. God bless you all. Great
You
work.
as well.
Great work. Carl, I'm calling you. Good
Okay.
job, Sharon. Great job.
Thank you.